All right, take it away whenever you're ready. Thanks.
Right. Well, good morning. My name is Lily Mulato. I'm the patient navigator, program manager at Huntsman Cancer Institute. And let me set up our presentation really quick. Mhm. I'm so sorry. I'm having a little bit of technical difficulties as it is expected under pressure, right? So what I'll do instead, share my screen. Are you guys able to see my screen?
Yes, I can see your screen, but it's not the shared part of the presentation. It's just your whole screen. Well, it's not in presentation view yet.
Okay, let me close some things then. That should be the presentation.
We can see your presentation. It's just not in a slideshow view yet. Perfect. I see you going to that. Great.
Come on. All right. I apologize for that. Thanks everybody for your patience. So anyway, like I was saying, Lily, I'm the program manager for the patient navigation programs at Huntsman Cancer Institute, and I belong to the public and patient education department. Our patient education department houses our learning center and our library resources, which Jeff will start talking about in a little bit. I specifically oversee the Hispanic navigation program and the Frontier Rural Navigation. Amelia will actually be presenting about Frontier since she's the expert in that program at the moment. And then we'll have Adolescent and Young Adult, which Carly will be presenting. And then we'll circle back to me with American Indian patients. So I'll go ahead and turn the time over to Jeff.
Great. Thanks, Lily. It's good to see everybody. There's a few familiar faces and names, and so it's good to connect and see you all again. Our presentation, just we wanted to kind of tie everything together under our department umbrella. The Patient and Public Education program here at Huntsman Cancer Institute was founded with Huntsman Cancer Institute. It's one of the original programs. Founded back in 1999. If you know Donna Branson, who's our department director, she is the one who got the department started. And at the time, it involved a couple of the kind of early programs that you see with a growing center, and eventually it's kind of grown into being a program that provides education and resources for our patients and their families, as well as members of the community. It includes, our team is 11 right now, I believe, which includes our director, our associate director, 2 program managers, 6 health educators, and an administrative assistant. And one of the things that distinguishes us is that we are part of our clinical efforts, but as we're also part of our research efforts. And so what our role is to not provide specifically clinical education, but we're here to provide non-clinical support and help patients kind of get to where they need to go, and find the resources and assistance they need, whether that be something that's in-house or whether it's a community resource or educational resources that are most helpful and most pertinent to them. Next slide, Lily. And that takes us to the Cancer Learning Center. Let's go to the next slide. Our Cancer Learning Center is one of the original programs at Huntsman Cancer Institute. It was actually among a part of the vision of the Huntsman family, that when they were dealing with a medical crisis, they were looking for information and they couldn't get it. And so they wanted to have a place where they could access lay or patient-friendly resources that isn't in a textbook or in a medical journal. And so that's where the Cancer Learning Center came from. And it's a physical location, and that includes a lending library, but there's also an attached information service where people can reach out by calling, emailing, texting, live chatting. They can stop by and visit our team. It's staffed by a team of health educators, and our team combines to having more than 80 years of experience in providing cancer information to people. Our resources are free and available to the public. And so it's a resource that a person does not have to be a patient here at Huntsman Cancer Institute. They can reach out to us anytime, and we are happy to provide them with information. Because we are a library, we do attach ourselves to a lot of the ethics of the library in terms of not being biased. And so if a person were to say, is Huntsman Cancer Institute the best treatment in the world? We're going to say no. We're going to say and help them find exactly what it is that they're looking for and what is kind of behind what that question may be. And let's go to the next slide, Lily. And the types of resources that we provide are pretty much anything pertinent related to cancer, recognizing that people are coming to us for a lot of different reasons. Sometimes we have people who are contacting us because they have cancer or they have cancer in their family. Sometimes they contact us because they're at risk for cancer and they want to try to manage that risk. In some cases, it's a student who's looking for help writing a paper or doing some kind of school assignment on cancer. Some people are reaching out to us because maybe they want to know more about research and trying to identify a cure and how they can be part of that process. And so we're just kind of here to help out. Our lending library we have curated about 3,000 different items. I think I have another slide on that. And everything that we provide can be given. We can email items to people that would that helps keep people off of Google a little bit if we can, as well as can provide them print and circulated materials. Our lending library has about 3,000 items. Everything is related to cancer in some way. We kind of joke that we're not a fun library. We don't have fun books, but we do have things that we feel can be very helpful to people. And this is available to anybody in the area, in the community. And so if you have anyone that you think might benefit from things, and this includes anything from information about cancer treatments, but a lot of things that are really practical, such as cookbooks that can help manage side effects, or guided imagery, meditations, books to help explain cancer to children. A lot of these things that aren't necessarily easily useful online or accessible online, and where a lending library can be really helpful. We can provide those to people all throughout the state of Wyoming. They're welcome to reach out to us. and we can circulate everything through the mail, and it's all postage paid for them. So there's no need to come in, and there's no financial burden that gets placed on the individual who is looking for assistance. And so people are welcome to contact us. They can also search our collection at huntsmancancer.org/CLC for Cancer Learning Center. And I believe I turn it over back to Lily.
Yes, so that takes us to our, that takes us back to our Hispanic navigation program. And this is our current staff. So we have Naomi and Morella. All the three of us are native Spanish speakers. And so kind of a little bit of background. So the Hispanic Latino navigation program, also known as the Spanish speaking patient navigation program, starts in Huntsman about 2009. And it comes out of necessity, just like everything else. So the community, specifically the Hispanic non-English speaking community, trying to find cancer care and kind of finding ourselves in a position where we didn't really have the resources or the appropriate people to address their concerns in terms of answering the phone and just kind of finding out what people needed. And it was needs that were very fundamental, like having someone who speaks Spanish answer that phone call, right? And give the patient or the caller the opportunity to explain and see what's going on and offer resources. And so a navigation program is started. And as of recently, we have helped about over 2,000 patients over the span of over a decade. We're also helping families. So if the patient is a U.S. citizen born in the U.S., English speaking only, but their wife or their significant other is Hispanic or Spanish speaking, we'll assist them through the process. We found that it's incredibly important for patients' families to be aware of what's going on, and it just makes them better caregivers and give them support to the patient and to themselves, because cancer is one of those where it affects not just the patient, but everybody around them, right? And making sure that everybody's needs are met is the best way to provide care for that patient. So we assess, the area we serve at Huntsman, which is Colorado, Idaho, Montana, Utah, and of course, Wyoming. And I've been with Huntsman for about 12 years, so I've had the privilege of helping everybody from those states. So kind of the common barriers to having a Hispanic population that needs cancer care. So obviously the first one is language. And we do have an interpretation department that takes care of language needs. But in order to serve the patients in the best way possible, our navigators are native Spanish speakers. The other thing is that many people don't know is that within the Latino community, it isn't really that they don't want to have health insurance. It is practically impossible to have it, especially if you're combining that with immigration status. The lack of access is huge, and it becomes quite problematic when these patients are trying to search for help, especially once they've been diagnosed. And of course, the cultural barriers, there's HIPAA and there's also informed consent, which kind of goes a little bit into issues with the culture. We don't really culturally talk about cancer very much, and is considered kind of a death sentence type of situation and taboo to speak about it. And also with end of life processes, those conversations are quite unique in the family structure. And when we found out that when we follow that cultural family structure, those conversations go a lot smoother, and a navigator can easily kind of help the patient, their families, and the medical team kind of coordinate and address that in the best way possible, given the circumstances. And of course, contrary to public opinion, patients who don't have an immigration status in the U.S. are not eligible for any government assistance. So many of these patients find themselves unemployed, uninsured, without access to disability or Medicaid or food stamps or rent assistance or anything like that. So it's quite challenging to help these patients and make sure that these barriers don't lead them to abandoning their treatment, because it is, their treatment is everything. Without their treatment, they won't be able to go back into the things that they want and that they love to do, which usually comes down to taking care of their families. So a navigator role at Huntsman is primarily to advocate and educate the patient. We want our patients to be making those informed decisions by themselves. So we offer all the education and advice and kind of advocate for them. Like I said, we're all native Spanish speakers, and we understand the Hispanic culture in a broad sense, right? Because everything south of the border is Latin America, and cultural and language can vary from country to country, but we do have kind of the basics covered, and we're very adaptable in that regard. So we have access to the electronic health record. So in our case, it's Epic. So we're able to get pretty familiar with what's going on with the patient without putting an additional burden on the medical team. So we can go into Epic and look into all of those things. And we also chart in Epic, so the medical team is aware that a patient is being navigated. And if some of these practical barriers keep coming up into their appointments, they can easily refer back to navigation or reach out to navigation and request an update status on where things are coming from with this patient. And so to reach a Hispanic navigator, we have a Hispanic navigation line, and that actually rings in all of our phones. So Lily, me, Naomi, and Mariela. So the goal of this is to make sure that you do get to speak to a navigator as you're placing that referral. We also kind of have a catch-all navigation email. So you're welcome to send your referrals to navigation@hci.utah.edu. We try to make it very easy to remember. And so if you're not sure exactly what the phone number is, you can always email us and we'll get back to you as soon as possible. Then I think I'm going to go ahead and turn over the time to Amelia with the rural program.
Thank you, Lily. Hi, everybody. It's nice to see you guys. And like Jeff, I know a couple names on here, so it's good to be with you. So I'm Amelia. My last name is Talene. I don't expect anybody to ever know how to pronounce it with the silent H, but I am, like Lily said, the rural navigator, the frontier and rural navigator. And I have been with Huntsman since November. Lily, do you want to go to my next slide? Thank you. So like I said, I've been with Huntsman since November. This program is new to Huntsman. We were able to start this program through a generous grant funded by the American Cancer Society. And so because it is a grant and it's kind of a pilot program, this program is only for the time being covering Wyoming, Montana, and rural or frontier Utah. So while like Lily mentioned, the Hispanic program covers all of the area that we serve. For right now, this program is just in this small area while we build the program. So we know that about 35% of the patients at HCI travel over 40 miles. And that estimates out to be over 1,200 patients just from these 3 states. So there's a lot to be done here. In the first 6 months of the program, we navigated about 100 patients. So we've started to attack that and get some of these patients the services that they need, but there's still a lot of work to be done. And Lily kind of went over what the role of a navigator is. I don't think I need to go into too much detail about the needs of rural people and rural patients coming to our facility. I'm sure you're well aware of what some of those barriers are with transportation and travel and and things like that. But like Lily mentioned, the role of the rural navigator is to be that subject matter expert and advocate for patients with our providers and care teams that may not understand what those barriers are. Connecting patients with hospital and community resources. A big thing is coordinating between healthcare systems. So when we have patients that are coming to us referred from another facility, sometimes it's easy for those things to get kind of lost in translation. And so it's nice for patients to kind of have somebody to advocate for them and make sure that all of the go-between, the back and forth happens when they're being handed off to Huntsman and then handed back for care locally. And like the other programs, helping with employment concerns, insurance and financial questions, and that includes applying for financial aid, both with Huntsman and with other resources in the community. Support and connection. It's really important for patients when they're coming here, especially from small towns and small rural hospitals, to be able to have kind of a friendly face, somebody to just kind of show them around even, or just help them feel a little bit more comfortable in this great big facility. Survivorship and wellness resources, understanding the healthcare system, and then any other concerns that come up. Next slide, Lily. So the referral process for the rural and frontier program is a little bit different because we do have our affiliate hospitals. We have the Memorial Hospital of Sweetwater and St. John's Health. They have a specific OPC or outpatient coordinator that they go through, and that is Laura Pay, and her information is there. She is amazing, and so she takes all of the referrals from those two facilities and then kind of triages them out to the specific OPC that will set up the appointments and things. For anyone else, you're welcome to contact me directly. My information is on there, and that QR code, if you scan that, will go right to our website that also has my information on it. So if you want to just take a picture of that or whatever, that'll get you there really quickly. If you can't remember this or you didn't get it down and you got down Lily's information, you can also reach me through that navigation at hci.utah.edu. And I will turn it over to Carly to talk about the AYA program.
Awesome. Thanks, Amelia.
Amelia, was your email correct? It was missing the L in your name.
That is not correct. Thank you for pointing that out. I did not catch that. Thank you so much. But yes, it is THELIN.
Nice catch. So yes, like Lily has said, I am the Adolescent and Young Adult Program Manager and Patient Navigator. You can go to the next slide. Perfect. So our Adolescent and Young Adult, or AYA, as you'll hear me say, navigation program, we serve patients with a cancer diagnosis and their loved ones between the ages of 15 and 39. So we're looking specifically at this age range because we found that there are unique challenges, unique things that these patients come across and are dealing with. And then in general in life, right? And then add cancer on top of that. And it adds a lot of complications and things that they're trying to navigate. Our program was started in 2016. We serve patients in Utah, Idaho, Wyoming, Nevada, and Montana, the areas we serve. We saw approximately like 300 AYA patients in 2022. So that's kind of what we're seeing roughly yearly. And then we can assist patients with, different areas that may be of concern to them, specifically at this age range, looking at, education. How do they navigate cancer and college? Employment, a lot of them are just starting out in their desired employment, or just in general, just graduated high school or just graduated college, or just trying to build that kind of stuff. So just kind of navigate them to resources with that. Fertility is a big one. We will be getting a fertility navigator next year. But for now, I can kind of help them know of resources, financial resources that exist, and kind of connecting them to our reproductive endocrinology clinic, and answering kind of general questions, and connecting with them with their team. Financial resources, community resources are huge, just because, with this age, peer connection is big. Not feeling nobody in their age group, not nobody, but very few people in their age group understand this world of cancer, and understand what it means to navigate a diagnosis. And so it can be very isolating. And so we do have a support group that we'll talk about, and just kind of there's other like national community resources and connections that I can connect them with. Insurance, survivorship. I think we have about an 85% survival rate nationally in this age group, which is awesome. But then they're dealing with it for many, many, many years of dealing with long-term effects. And so kind of connecting them with survivorship and what that looks like, and kind of helping them be aware of that as they move forward. Lily, if you want to change slides. So I talked about our support program that we have. This is actually in collaboration with Intermountain. So it's a Huntsman Intermountain Adolescent and Young Adult HIA group. And we have social media. So if you have patients, you can definitely connect them with us or social media. We have Instagram and a close Facebook group and a TikTok, trying to reach this age population. And then we have what's called Young Adult Connections, where we have monthly meetings, sometimes twice a month. Some are virtual, so we do have that option for patients that aren't local. And then some are in person if they happen to be here for meetings or appointments. And then another thing to keep in mind, to be a part of our program, the social aspect, they do not need to be a Huntsman patient. The only qualification is that they are AYA age, and that they are being treated in or live in the areas that we serve. So those 5 states. So for navigation specifically, that I do, and this is my referral stuff. So if you have a patient that's an HCA, you can go to the next one. It's okay. If you have a patient who is in need of navigation services, as far as like resources and being connected to different programs and clinics that are specific at Huntsman, I only do that navigation for Huntsman patients. But as far as our social programs, connecting them to national resources, helping them find young adult support groups that are maybe national too, if they're looking for that, or just even wanting to be a part of our social media and our events, they don't need to be a Huntsman patient. And you can definitely reach out to me, and I will help whoever I can get what resources are available to them, even if it's not through Huntsman. So that QR code also goes to our AYA website. So you can check that out. There are some resources on the website as well, our newsletter, some past events that we've done on specific topics, such as like navigating relationships through cancer, and body image, and different things like that patients could even watch if they're just looking for something to find some information on this age range and how to deal with certain things as they're going through cancer. We do have some presentations and past events on there. So sometimes if they're not ready to actually interact with other patients, they can at least go and know that they're not alone, and that these topics are being addressed, and kind of find that information there. So that's our AYA program. And I think it's back to Lily.
All right, right, so the last portion of our presentation is our American Indian Navigation Program. And this one is one of the oldest and one of the newest program that we have. The oldest in terms that we have had an American Indian Navigation Program that predates the Hispanic program, but their focus is mainly outreach. So they're out in the community and the reservations, educating patients about prevention and healthy lifestyles and things like that. So Mariela, as of July 2023, I'm sorry. My bad. So as of last month, she started navigating patients inside Huntsman. She is meeting with patients in person and helping them pretty much with the same barriers that we do see, right? All the logistical stuff with scheduling appointments and getting into conference calls with the medical team to kind of make sure that everybody's on the same page, or financial assistance, lodging. Many of these patients are coming from the reservations or out of state as well. She'll be serving the 5 states, the area we serve. And she's going to be working very closely with Phyllis, Nancy, and Nathan J. They are part of the American Indian community and culture. So for all cultural needs, she'll be referring them to Phyllis or Nathan. But in terms of the practical needs of making sure that your patient makes it into Huntsman, that they have proper directions, that they have, they know where they're going to stay, they're going to know if they have several appointments on the day type of situation. All of that can be going through Mariela. And you can contact her directly at 801-646-4276 or her email as well. And just like the rest of the navigation programs, if all you remember is that navigation at HCI email, you're welcome to send an email there. We all have access to that and can return the call and assist with that one. Obviously, we don't know a lot about this program yet and how it's going to work, but we're in the process, and we're excited to start seeing patients and assisting them in this capacity. And so before I open up for questions, I wanted to add 2 more things. One of them is that we all belong to the same department. So if you're not sure if if a patient should be going to Carly for AYA, because they're also Hispanic and Spanish speaking, don't worry, you don't have to make that decision. Just refer to one of us. We work very closely together and often visit patients together and assess their needs and divide and conquer type of situation, right? It isn't unusual for Carly to address the patient's needs because they're younger and their concerns are the concerns of every AYA. But their parents are Spanish speaking only, and their concerns are more cultural and in terms of what's happening to their child, even if that child is already considered an adult because they're older than that 18 age mark. So I would say don't worry too much about figuring out where your patient fits. If there's a need, go ahead and send them over and we'll take care of them as best as possible. And the other portion that I wanted to mention is that it's kind of ideal that we do have as well Jeff services with the Cancer Information Service. So if your patient doesn't really fit any of the navigation programs, Cancer Information Specialists and the library is still available to them and provide them with a lot of the resources that navigators have type of situation. Kind of the downside is that they don't do a lot of follow-up like we do with patients, but they are always welcome to come up and visit. And it is actually something that happens quite a bit. Once the patient finds that the library was really helpful, they'll come back time and time again and seek out the help of our librarians and our services. So we are open for questions. Well, if any questions come up, feel free to go ahead and send us an email, give us a phone call, and we're happy to help in any way possible.
Great. Thank you all for presenting from the Huntsman team. Again, any questions come up, you can, of course, reach out to them, or of course, you could also reach out to Star. And I do have a few reminders for the group. If there are any support group flyers or any details, be sure you share those with Star so she can get them up on the YCC website. And just as a reminder, there is a link to the strategic plan on every meeting agenda. So make sure you're going over that and just taking a look at that strategic plan. And if you have any questions or would like to discuss that further, we can do that with the group. I think that's all I have. It looks like Lee is on the call. So Star actually mentioned Lee maybe wanting to touch base with the group about the outcomes of the cancer directors subgroup. So if you have a minute, Lee, that'd be great.
I wasn't prepared for that.
Put you on the spot.
That's all right. It went really well. I think we had everybody on but two cancer centers. It was just nice to have kind of everybody. It was, I don't want to say it was a good venting session, but it was just nice to hear we're all kind of running into the same barriers as far as staffing, insurance, those kinds of things. It was just kind of nice to regroup. We did it a long time ago, so it was nice to kind of regroup and have those things. We are going to have reoccurring meetings, so that will be good. Trying to think, those were kind of the big things. We kind of went through, each of us went through our pain points of kind of what's going on at each center. Everyone's super busy at each cancer center, staffing struggles, those kinds of things. Sorry, if I would have had time, I would grab my notes, but I have no idea where they are right now.
No worries at all. She just figured if we had a few minutes, we could, kind of dive into it. So no worries at all.
Yeah, it was really good to just reconnect, network, because obviously everyone's kind of had some staffing changes at the director levels. And everyone obviously wants the best for the patient. So it's always nice to know too that we're all on the same page, wanting the same thing for the patient. So it was good. We're excited to kind of keep having those meetings and all stay on the same page. There's several of us that are going through some medical record EHR changes, like whether it's from Meditech to Epic or whatever that looks like, and to know who's kind of on what so that we can use each other for resources. So that was nice too. Just in general, very nice to collaborate and kind of keep developing those relationships between each center. I don't know if anyone else is on that was on that call. I think Tasha might have been. If anyone else.
I was there and I agree with everything you said. I thought it was really nice to collaborate and
tell Tasha to come work with me.
That would be fun. But yeah, so it's just great to collaborate and share resources and ideas, and just hear that we're not alone in the challenges that we're going through. We're all kind of in the same boat. So no, it's been a great thing.
Yep.
Great. Thank you both. It's always nice to have those collaboration sessions where unfortunately you hear about, other people having the same exact problems, but it makes you feel a little bit better about, the issues that you're having. So that's great.
I'm not the only one on the crazy train. Yep.
Exactly.
Yep.
Anybody else have anything to add to the group before we head out?
Hey, this is Caitlin from St. John's. Just so y'all know, I had a woman reach out to me interested in starting a breast cancer support group in Lander. If that gets off the ground, I'm happy to let the group know, but it'll be her spearheading the effort. So.
Great, thank you. I think that actually might have been the same person that I talked to that I passed along to Star. So it'll be really good to get some momentum on that. As a reminder, the next meeting is September 25th. There will be a few guest speakers, American Cancer Society, Wyoming Breast Cancer Initiative, and Shine Regional Cancer Center. So definitely stay tuned for that. And if we don't have anything else, I'll give you a few minutes back in your day and we'll leave it there. All right. Thanks, everybody.
Sorry,
Thanks for
I didn't
joining.
hear you.
Bye.